Thank you, Susan. Hello, everyone. We appreciate your taking time out of your busy schedule to meet with us today. This is a new product for us, as Susan mentioned, partnering with Nuance on the Clinic 360, and we are extremely excited about it. It has been used at the hospital level and larger clinic level for several years, so it's a proven transcription solution. Feel free to ask questions at the end of our presentation today. If for some reason we are unable to answer a question, we will collect your information and provide the answer to you by phone or email. But we'll do our best. So this is a summary of what we'll be covering today. I'll provide you with an overview of the solution. We'll talk a little bit about the market dynamics, and then we'll go into just superficially the differences between structured and unstructured interfaces. And then we'll go over a little bit of the workflow, the benefits, the features, and then our commitment to you. And then after that, I will hand it over to Josh. He will show you the mobile phone workflow, and then also the dashboard that will be used by your administrative staff. Next slide, please. Okay, I apologize for the detail on the slide, but it has a lot of good information. The first bullet basically just identifies that it's for the traditional side of transcription, we will offer a 24-hour turnaround time with typically the 11 to 12-hour time frame. Then we have a stat option, which is a 4-hour turnaround time. And with both options, we're resulting in 99.1% accuracy, so pretty darn accurate. Okay, so the next bullet. It's just relating to the choice of dictation mode. You'll be able to dictate, and we'll go into this in more detail, from a digital recorder, from your iPhone, Android phones, or even from a landline. Then we'll go a little bit into the structured templates that are offered with each EHR, so that you can actually use your phone to go through a patient's note, edit, sign off, and go on to the next patient. Okay, the third tool, or the third bullet, basically the ultimate goal is to reduce the time taken to dictate and also enable physician mobility within the practice. Okay, next slide, please. All right, so basically these are some images on the dynamics that are going on in a medical practice today. And so basically the first image on the left, I guess the summary would be that there's more regulation, you're working harder than ever before, and you're seeing reduced reimbursements, unfortunately. The middle slide, we have a way to offer better supporting documentation so we can help you increase your reimbursements, as opposed to simply pointing and clicking in your EHR. And then the right image, Clinic 360 allows you the ability to elaborate on a patient's condition while not interrupting your EHR workflow. Next slide, please. Okay, Nuance conducted a patient survey last year, and the left image basically is stating that patients feel during a visit that they're receiving less face time with their doctor. And if a scribe's in the room, they feel that they receive even less face-to-face time. The middle slide represents that, or I should say indicates that patients are becoming more of an advocate for themselves and for their own health, and they want to have meaningful conversations with their doctors during their visits. And then the right image, the survey results indicate that patients recognize that technology is here to stay, but that they need a balance, which would ultimately enhance patient satisfaction. Next slide, please. Okay, this is my favorite slide. This represents just a sprinkling of the EHRs that we have interfaces with. And there are a couple of different types of interfaces that we have with the Transcription 360. One is called unstructured, which is more of a standard transcription model. And unstructured means that you would dictate your narrative. They get sent out to a transcriptionist and transcribed into a Word document. They'd be saved in a PDF and sent back to your EHR, where it would attach that document, that PDF, to the patient's electronic visit. So it wouldn't get embedded or incorporated into the note. It would be attached as an addendum. As opposed to a structured interface, same scenario where the transcription gets sent out and transcribed, but it gets transcribed in the templates that are already pre-customized and developed for each provider, which is done during the implementation process. So those templates are transcribed, those visits are transcribed and sent back to the EHR. The EHR then, with an HL7 interface, actually pushes that information into that specific aspect of the note, whether it be HPI, assessment plan, patient, the patient general visit, that type of thing. So feel free to contact us to find out what type of interface exists for your particular EHR. All right, next slide, please. All right, and this is another busy diagram, but basically it's showing you that interface, that structured interface. So you're dictating a narrative, it's transcribed, and it's sent back into the visit note. So it's pushing it into these parts and embedding it into the note so that your EHR can take it and code it and provide that discrete data for billing and for meaningful use. Next slide, please. Okay, this is showing the workflow, and it's a conceptual diagram, but basically to take away from this image, you can dictate using your mobile phones, digital recorders, or even a landline. Get sent to the transcriptionist, sent up to the cloud, sent into, if it's a structured interface, to our interface engine called ShadowLink, and then sent back down and placed in the appropriate sections of the note, and then sent back down to your workstation or your mobile phone. And then the bottom part is related to the administrative aspect of this, where there is a number of reports that you can generate, productivity reports that your administrative staff can use that will be helpful to them, and that's what that represents at the bottom. Okay, next slide, please. Okay, key benefits. All right, the upper left-hand side, basically, you can dictate narratives in front of the patient. The flexibility also includes dictating at a station, in your office, or even at the hospital. The bottom left is basically just summarizing the mobility, that you can use mobile phones and digital recorders. The bottom right is structured interfacing that we were discussing earlier for a more detailed patient note. And the upper right-hand corner, the dictation template, as I mentioned, is customized for each provider based on visit type and interface availability with your particular EHR. Okay, next slide, please. Okay, our services, our commitment to you. We have a 24-hour turnaround time with an average of 11 to 12 hours, and then the 4-hour stat that I mentioned, and both with a 99+% accuracy. The deployment time frame. Within 3 days of an executed contract, we have a kickoff call with our implementation team. And then you can anticipate going live 4 to 6 weeks after the kickoff call, depending on the resources that they need to get in place for the volume of your particular transcription, sometimes sooner. The implementation team then handles the interfacing, the templating for the providers, and the initial training, and hold your hand basically for the first 45 days until you're comfortable with the whole workflow and process and running reports and such. And then they hand it over to the support team. The support team does conduct some reinforcement training, they support, and then they become your account managers. So that's the summary of our services and our commitments and an overview of the Clinic 360. I would like to thank you for your time, and now would like to hand it over to Josh for the demonstration.
Yes, hi. Thank you, Bonnie. Thank you, Susan. Again, my name is Joshua Collins. And, today I'm going to show you a couple of key features here with the Clinic 360 solution. One of them is going to be the Clinic 360 mobile app. And that's really where, as a provider, you probably spend most of your time, getting in there and managing your notes. And the other side of it is a web portal. So we're also going to take a look at the web portal, which could be used by administrative staff. As Bonnie was mentioning earlier there's some great reports in there. Or the provider themselves could still use the web portal to go in and review the notes as well. First let's talk about the Clinic 360 mobile app. And, it really gives you the freedom to dictate, anywhere, anytime. You can really do it all from there as far as creating your note, picking your patient, creating your note, editing your note, reviewing it, signing off on it. It's really all built into the app here. So, it's really kind of a one-stop shop as far as that goes. Everything is accessible for you there. And because, you do have the freedom to dictate anywhere and any time, that just naturally is going to improve your productivity. It's going to improve your quality of patient care as far as, you're not having to be tethered to the machine, or the computer, or the EMR. You can have more, face-to-face time with your patients there. And, because everything is integrated with the EMR, everything is routed automatically, that's really where it's also going to improve, your billing time, your turnaround time for reimbursement. You'll get reduced claim rejections, and, it really is a complete solution here. So let's go ahead and take a look at just a couple of quick notes on the mobile app. So it is going to work for Apple or Android, so you're really covered in either area there. Very simple, easy to use. We'll take a look at a few screenshots here in just a moment, and we'll go through a couple of workflows there. But like we were saying, you can really use it to create, review, and edit all of your notes, and then sign off on any notes as well. And it does have a real-time patient list. So just as a typical EMR would, you're going to be able to get in there, see your patients, see their demographics. You can flip forward and backwards, as far as a typical calendar, and you'll have your real-time, patient list there as well. And then also another nice feature is, as you're dictating, you can go back and review your previous notes, which, it's hard to do nowadays with a lot of the EMR systems, that we see. It's not as easy to go back and, kind of read your previous note while dictating or, working on your new one. So it's very, very handy to be able to go back there and see those previous notes. So let's go ahead and take a look. The next slide, we're going to have just a few screenshots that we're going to go through. We're going to talk about really those two main types of workflows that you're going to be, going through on your mobile app here. So, from the provider standpoint, you're going to have a login and password. So you'd open your app, you'd log in, and these screenshots are kind of in the order here that you're going to be going. So you log in, you then be presented with your patient schedule along with all the demographics. And again, you can go, forward and backwards, yesterday to, tomorrow. You have, the options there as well. From there, you're basically, just tapping on whichever patient, you're wanting to create a note for. And the last three screenshots there, you can see, you do have the ability to use templates as well. So, aside from just the standard, recorded dictation, you could also implement, a normal physical exam or review of systems into your note along with, your recorded dictation. So very straightforward, very easy to use. It just takes a couple of taps really to kind of get in there, open up your patient, and begin dictating. So that's one side of it. The other side is, after you've dictated, the notes come back, it's been transcribed. You want to go in and review it, make sure everything is okay, do any editing, and then finally, complete it with your e-signature and sign off on it. So that's what we're looking at here. And these screenshots are for the Apple app, but very similar, to the Android, basically the same thing there. But, here on the first screenshot, you can see kind of your different inboxes, whether it's waiting to be reviewed or still waiting to be typed, or, in something you need to sign off on. You have some options there. And basically, you would just tap on to whichever one you're looking for. Here in the next few slides, this is an example of going in the box and reviewing anything that is waiting to be reviewed and completed. So that's the screenshots you can see here. You see the note there on the third screenshot. And then the last one gives you the option to go in there and edit it, or if everything is correct, you could just complete it and go to the next one. So very easy, very straightforward to use there. And as a provider, you could really spend all of your time just here with your mobile app, and it's really all that you would need to do. Another side I want to show you here, though, is I want to go ahead and show you the web portal. So again, this is great for administrators, or this is your other option as a provider to go in there and review and sign off on your notes and documents. So let me go ahead and switch over. All right, so once you log in, this is kind of your home screen there, the web portal. You have a lot of useful things here. You can go through and change preferences, and you can get help, help desk support, and a lot of manuals, instructions are available here for you. You can also see a snapshot of your workflow. So over here on the right, you can see how many notes are out there sitting, waiting to be reviewed or waiting to be signed and printed or coded. So you have a lot of options there as well. And we'll take a look at that in just a moment. But first, I want to go ahead and show you the reporting section here. So we're going to go ahead and click on Reports. And it basically just brings us to this tab in Vision here is the reporting system. So here is just an example of some of the reports that come with the system here kind of out of the box. Anything that you do want to change or possibly create your own report, you could definitely do that here. Very flexible and powerful as far as the reporting features go. So anything you can think of as far as any kind of data you're looking to mine, anything you're trying to figure out with your reporting really could be created there. You would just let your project manager know, and they could we could definitely get that done for you. But just a few examples of some reports here. I'll just scroll down a little bit. So you can just see, everything from transcription production to, turnaround time compliance. Really, they do have a good set of default reports here to look through. And I actually ran one ahead of time just to show you guys here. Let me go ahead and pull it up. So, it's just going to create the report as a standard PDF document. But, here we have an unsigned transcription summary. So basically, very nice to just easily have a report of, okay, these are the ones we need to go in there and sign off on. You see it lists them by provider, and then it goes ahead and lists the patient's name and demographics. So you know exactly which note you need to open up there and get signed off on. So from the management and administrative point, very powerful, very useful reporting features here. And I think you guys will definitely love that feature of it. Now, going back to the provider, if you do want to go in here and check out your notes waiting to be reviewed, we could click here on the Workflow tab, and you see here these are all the notes that are kind of waiting to be reviewed here, and then finally be signed off on. But anything you do want to change, if you do maybe want to go here and edit, it's real simple. You just find the patient, click on Edit, and let's see. Let me try another option here. You know what, maybe they're having some trouble with the database here. It doesn't seem to be editing. Let me just try one more time. Nope, looks like it is maybe going down here. So you know what, this is a test database. There may be some other hands in here. Yeah, it looks like it's been closed out there. Let me go ahead and sign back in here one more time. We'll see if we can pull that back up. All right, here we go. So we'll go back to the Workflow tab. Just really quickly wanted to show you guys that edit feature. So we'll go here under the inbox. We'll go back here to edit. And then easily you can go in here, review the transcribed note, and then easily go in here and make any changes. And you could potentially use Dragon in here as well. If you have Dragon on your computer, you could definitely get in here and use Dragon to make these changes as well. Then just go ahead and save it and complete it when you're finished. So very easy to use, very really straightforward, but very powerful as well. So it's a nice web portal. So you have this along with a mobile app, and that's really going to be your two ways that you're going to get in there as the end user whether it's the provider or, you know, the administrative staff to really go in here and manage and get a handle on everything, you know, Clinic 360. So with that, I want to go ahead and turn it back over to Susan here